Grabbing yourself a tennis ball, you can be in comfy clothes for this, as you can see. Place the tennis ball on the floor and just rest the pad of the heel on it. Push down so the tennis ball divots and then drag it back and forwards. It feels unpleasant but nice. Within pregnancy especially, our calves get tight, our lower backs can get tight, and sometimes this can all stem down to the fact that our feet are so tight. So it's really important to release any aches and tensions here. Your supporting leg has a slight bend in the knee. If you have any dogs, I advise you putting them away so they don't think that you're teasing them with a tennis ball. But keep rolling forwards and back. Also take it to the inside arches of the feet, the outside arches of the feet. If you find a spot that feels particularly tight, you can really rock and push forwards and backwards a little bit more onto that area, or you can press and hold. You can also, as you drag back, wrap the toes around the tennis ball as you get towards the balls of the feet. And then we'll swap sides. Push down through the pad of the heel and drag it back. Keep going forwards and backwards. Weight is in the back leg, soft bend in the knee. Roll onto the inner arches, the outer arches. And again, if you feel like you find a spot that is particularly tight, either press and hold it there or do quicker rocks forwards and backwards. And you can also drag back and wrap the toes around the ball as you get to the ball of the foot. And then picking your ball up, sitting down on the floor. If you have 2 blocks, place 2 blocks next to each other or books next to each other, like you're creating a little table of blocks and books. And place just at the very bottom of the calf, rest it onto the block. And then just start to press and roll. So you're not on the Achilles tendon itself, you're just above, right at the base of that calf muscle. You can rock side to side, you can just press and hold, you can rock forwards and backwards. Every time you've released that barrier, you can move the ball up a little bit, your leg down a little bit, and just make your way up the calf muscle in this way. Little circles, little movements, press and holds, just choose whatever feels good for you. Making your way all the way up to the top of the calf. You're not rolling on ligaments behind the knee or anything like that, but only doing your calf muscle. Swap legs once you've done it. Again, I mentioned that calves can get particularly tight. And all of this tightness in our feet, our calves, result in tightness in our hamstrings, result in misalignment of the pelvis, result in tightness of our lower back. And then once you've done both calf muscles, put your books and blocks away. Take your ball and this time add another ball to it. Place it in a big sock, a centimetre between each ball, and then tie a knot at the end of that sock. This is so that the balls never roll on your spine itself. You place them against the wall, you put your lower back against it, just above the sacrum, and you just gently rock up and down. Ball is either side of the spine. gently massages in, it eases any tension away. You don't even need to rock up and down, perhaps just holding it stable is enough for you. If you feel like the tension is targeted onto one side, you can turn the balls the other way up, vertical, and just gently press, or you can rock side to side there. Again, making sure the balls never press into bones. And these are really good tips to use during labour as well. If your partner can't be present for some sacral pressure or light touch massage, you can use these balls in this way. So if you particularly feel tight in your glutes, you can move the balls to your bum. Just pause me and take a moment to do this on both sides of your lower back and both butt cheeks. And then lastly, if your partner can be there, you could lean against a wall or you could sit down on a birth ball. Whatever you're choosing, make sure you are leaning forwards. And then you can do some gentle light touch massage. You start at the lower back, backs of the fingertips, just start to draw the weeping willow up the spine. So they move up and out. You keep going all the way up until you get to your neck. And once you get to the neck, you go down the shoulders. So it's as if you're drawing that weeping willow or that palm tree up the spine. And this can feel really good. It helps to stimulate nerve endings, which help to reduce tension in the surges that you might be feeling. If you are feeling your surges predominantly in your lower back, then you might find sacral pressure is best. Partners can just rest their hands on your lower back, do little circles just above the sacrum with their thumbs, adding pressure there. You might find that they need to add more pressure and apply pressure right through the palms of the hands and out through every finger and just gently press down. They might need to make fists with their hands and do little circles. You might like them to do a figure of 8. Or they might press through the heels of the hands and slide the hands out. Sacral pressure can be done in many different ways. There's also a video linked on my YouTube hypnobirthing playlist, so feel free to watch that for some more inspiration too. But as long as you're leaning forwards, you have to be supported against something. So me, I'm resting my elbows on my knees. You might prefer to rest your elbows on a table or rest your arms on a wall. Just make sure you're leaning against something.